So in this study, we were trying to test a new novel option for preserving fertility in female cancer survivors. And we tested a compound that we predicted would be protective to the eggs in the ovary that would be destroyed by normal anti-cancer therapies such as chemo and X-radiation. In this study, we exposed ovaries of rhesus monkeys to X-radiation after they had received a compound into their ovaries for 1 week to see if it would be protective. And indeed it was. The animals were able to preserve a certain number of their eggs in their ovaries, and they were able also to get pregnant after undergoing the protection and the X-radiation and deliver live normal offspring. Cancer treatments can destroy the oocytes in the ovary, and it depends on what kind of cancer treatment. If it's different kinds of chemo or X-radiation, the duration of the treatment, but it can have devastating effects on fertility after the patients survive their cancer. So as more and more patients, particularly young patients like children, adolescents, are surviving their cancer, this becomes a quality of life issue for them to perhaps be able to choose whether or not to have a child when they get older. And those chances are gone if certain precautions aren't taken, either before the cancer or to help them after they survive the cancer. In women, the best option so far is to cryopreserve or freeze an embryo that can be transferred back to the patient for pregnancy. But this requires that you have a sperm donor, a partner. And so this option is not viable for prepubertal girls or adolescents or women who perhaps don't have a partner. So other options that are pretty much just experimental now include taking out the ovary itself and freezing pieces of the cortex, or the outside portion of the ovary that contains most of the eggs in their very earliest stages. Freezing those pieces and then being able to thaw them and transplant them back to the patient to resume cyclicity and perhaps to be able to extract an egg out to fertilize with in vitro fertilization and get an embryo. The disadvantages of this is that the reproductive life of this little piece of tissue is rather short, but at least it gives a chance. And you have the disadvantage of perhaps reintroducing malignant cells back into the patient, particularly if they're leukemia patients. And so you don't want to do that. However, there have been about 13 live births born from this procedure in women and 1 in the monkeys so far. So it does work, but it's experimental at this time. This particular experiment was successful in mice to begin with, and my colleague, Dr. John Tilley in Mass General, developed this technique in mice and showed that live offspring could also be born from mouse ovaries exposed to X-radiation or chemo. And that provided the support and the next step that we were able to take this into rhesus monkeys. And to be able to do this in rhesus monkeys is really important because we have the advantages, first of all, that their reproductive system is much more similar to that of women compared to a mouse. Second of all, we can actually carry these experiments out to a live birth. And since they are experiments, they would not be very ethical to perform in women. So we can take this extra preclinical step to ensure that the procedure is safe and can result in a live offspring that is normal.